Hi, I'm Dr. Don Bonner with Personalized Wellness, and today's video we're going to start this section that I talked about last week about lifestyle medicine. And typically the first thing I talk about, in this section with my patients is diet and nutrition. So to delve into this particular topic, the first thing I do is educate my patients on macronutrients. So your macronutrients are essentially carbohydrates, fat, and protein. So my typical patient that comes in that has weight issues, maybe diabetic, pre-diabetic, I talked about this before, I would say 90% of my patients I start on a ketogenic diet. That means getting your carbohydrates less than 30 grams per day for the most part. So the first thing we have to do is understand these macronutrients. I have my patients get an app for their phone so they're able to count carbohydrates. And that could be MyFitnessPal, that could be Atkins has a good app, and we start tracking your carbohydrates. And we want to get those less than 30 grams a day for a ketogenic diet. On a ketogenic diet, we're going to be eating a lot more fat and moderate amounts of protein. We don't want our protein intake to be very high, so we have to monitor our protein intake to a degree because we don't want it too high when we're on a ketogenic diet, because too much protein can lead to gluconeogenesis from the protein and increase our glucose, kick us out of ketosis. So we have to monitor all of those things. Now our fat intake is going to be much higher. Now the one thing that I would caution my patients about is if we go on a ketogenic diet and we plateau and we're not losing weight, one thing that I actually will do then is to look and see what kind of fats that they're taking in. And if it's mostly saturated fats, they do have a lot of calories in the saturated fats. So what I'll do at that point is try to decrease their saturated fats, increase their monounsaturated fats such as olive oils and avocados and that sort of thing, and to get our weight loss going again. Now the one thing you will notice, I don't count calories. We count macros. So the first thing we count is carbohydrates, and then if we have to, we keep an eye on our proteins and our fats. But for the most part, we're looking at high fat, low carb, moderate protein. Now the only time I will veer from that is if I get an athlete in the clinic, doesn't need to lose weight, he needs to maintain muscle mass, he's working out a lot, we will increase protein in that patient, and we will go to a higher carbohydrate diet. Those patients on a paleo type diet, they may get their carbohydrates to 50 to some of them 100 grams of carbs a day because they're working out so hard on that particular diet. But that's kind of the intro. We need to get an app for our phones. We need to start counting carbohydrates, and we don't count calories. So again, Dr. Don Bonner with Personalized Wellness. Click the subscribe button down at the bottom and click the little notification bell, and you'll be notified when I put a video up every Monday. I appreciate you watching the video, and we'll be back again next Monday. Thank you.